We've been working with communities across the state of Minnesota to develop data-driven strategies as well as action plans to close missing meals gaps at the community level. So thanks to funding from General Mills, from Cargill, from United Health Group, I have the distinct honor of announcing the first 20 Community Close-Up Grant Award recipients. So I'll read the list in alphabetical order, so please hold your applause until the end. But congratulations to the following grantees, and hopefully many of you made it today despite the snowstorm. So first, Cappy of South Minneapolis, Cross Food Shelf of Rogers, Minnesota, the Division of Indian Work of Greater Minneapolis, Egan Lakeville Resource Center serving Northern Dakota County, East Side Neighborhood Services of Northeast Minneapolis, the Emergency Food Shelf Network, a full-service food bank based out of New Hope, Family Pathways of Cambridge, Minnesota, Keystone Community Services of Greater St. Paul, the Minneapolis Medical Research Foundation, Minneapolis Public Schools, Neighborhood House of St. Paul, Neighbors Inc. of South St. Paul, North Country Food Bank based in Crookston, the Pine River Bacchus Family Center serving Cass County, Second Harvest Heartland Food Bank based in St. Paul, Second Harvest Northern Lakes Food Bank based in Duluth, Two Harbors Food Shelf serving St. Louis County, Valley Outreach of Stillwater, and 2 more to go, Western Community Action located in Marshall, Minnesota, and then finally Youthway Ministries from Blaine, Minnesota. So congratulations to all of you. Let's give you a big round of applause. So now I have the privilege of introducing Sarah Caruso. So Sarah, if you want to come up. So Sarah is, oh, please, yes. Sarah is the president and CEO of the Greater Twin Cities United Way, and Greater Twin Cities United Way is a founding partner of Hunger Free Minnesota. So Sarah, I'll turn it over to you.
Thanks, Jason.
Thank you.
Welcome, everyone, and welcome, panelists. As you guys are getting settled in and mic'd up, I just want to share 3 stories because I want to make this very real. You've heard from the suits, as I call the incredibly talented senior executives of these big companies. You've heard from our incredible data partners and Hunger Free Minnesota and Boston Consulting Group, what's really happening to connect data to what's happening on the ground in a conceptual, strategic level. I'm going to tell you 3 stories that have happened to me in the past week around hunger. I was principal for a day, had the privilege of being principal for the day at Battle Creek Middle School in St. Paul. You can see the 3M corporate headquarters from the Battle Creek Middle School. However, the Battle Creek Middle School does not meet state standards in 8th grade reading or math levels. It is a 1/3 African American, a 1/3 Hispanic, a 1/3 Hmong, and about 2% Caucasian children. That is a very full school, so it has about 102% enrollment. And as I was there in the morning as the kids were coming in through the front door, there's this long line of tables with food. Bananas, yogurt, snack bars. And here are these, remember, this is middle school. So here are these boys, some of whom look like they're ready for college basketball, some of whom are about my height, running in, girls all dressed up, and they're just grabbing food as they're going to their classrooms. And they could do it in a way that I think was private and respectful, but it was their food for the day to help them learn. Yesterday, I was driving over to St. Paul, and I went around the United Way building, and we have a wonderful charity, our closest United Way partner, called the House of Charity, which does a hot meal program, and it was right before they were serving the noon meal. And there was practically a traffic jam on Park Avenue, that's right, waiting to go in. And so that hot meal program, and the thing that was surprising to me is that there were middle-aged folks wrapped up in blankets. Remember, it was starting to get cold and rain. There were families with babies. There were grade schoolers. It was really sort of the sea of our age range that we've been talking about, waiting for a good hot meal. And I've been there helping to prepare the meals. It's a great service. And then I was in North Minneapolis at North Point Medical Center, which is this wonderful resource that has a food shelf, dental care, medical care, a clothing resource, and a lot of Hennepin County services are right there. So you can go into this food shelf, which has received a lot of grants to do things like build out their refrigerator freezer system so people can go there and get high quality food as well as calorie enriched foods. So this is happening everywhere in the world of Minnesota, let me say. And what we have here, and this is just a wonderfully designed program, is we have basically, you are 4 of my heroes because you are doing this work on the ground. And I think really understanding what this work is like on the ground. And we have four very different programs that are reaching out into the community. And so we're going to start hearing about that work. Before I ask these questions and try and hop on this very tall chair, we'll see how it works for me. I want to kind of help make the connection between United Way and Hunger Free Minnesota and why we think this is such an important initiative. So Greater Twin Cities United Way serves the 9-county metropolitan area, and Hunger Free Minnesota, of course, is the whole state. We have 2 connections. One is 50% of the hungry people are here in our catchment area. And we work very closely with 50 funded partners in the food relief area here in our catchment area, investing $4 to $5 million a year in this work, including $1 million co-investment in the Hunger Free Minnesota work. So we are very connected to this work in the Twin Cities area. We also have a United Way of Minnesota consortium. There are 40 United Ways in the state of Minnesota, and we are very actively working to connect the United Ways in the various counties and communities with this work, and we really want to be a conduit for that statewide work. Here in the Twin Cities, another very important partner is the Twin Cities Hunger Initiative, which is really sort of a microcosm of a lot of the work that's happening at the statewide level. And we're very grateful to have coalitions here in the Twin Cities as well as the statewide coalition. And the bottom line is everybody cares about the people standing outside House of Charity, the teenagers coming into the Battle Creek School, and the families and senior citizens who are at North Point Memorial up in North Minneapolis. So let's hear more about those programs. And we're going to do 2 rounds of questioning. And the first is, if you could just spend a few minutes, panelists, describing your organization and its connection to the work at Hunger Free Minnesota. So Rob, why don't you go ahead?
Great, thank you. Second Harvest Heartland is a food bank. As I think many of you know, we cover about 59 counties in central and southwest Minnesota and 18 in western Wisconsin. And so very much feel what Sarah was just describing, not only the weight of the Twin Cities hunger relief gravity, but also some very different challenges in some of our rural areas as well. So Second Harvest Heartland's main work is about collecting and distributing food as safely and efficiently as we possibly can. We're very much an enabler and distributor rather than a frontline service provider to those hardworking agencies, many represented here, that are really on the front lines of serving our hungry neighbors throughout the state and the parts of Wisconsin we serve. And it's a real pleasure to do this. I think David alluded to some of the challenges that we're seeing as we see the traditional sources of food. And I just came back from a conference of food banks in Nashville where we were describing this real change of how food banks and our emergency food system was born from recycling, essentially, from leftover food, from waste in our system, and how dramatically that is changing as we've seen the need rise over the past several years, but also as some of the traditional sources of that food have really changed, and what it means for us to be a more responsive system that is providing more nutritious food, more specific types of food, potentially culturally specific food, has been a really interesting change for us. And so it's a delight to be able to work with so many smart partners. I heard someone from our national office say that Minnesota was something of a Silicon Valley of hunger relief, which I thought was really interesting, but was also a tribute to the uncommonly capable nonprofit system that are here. Many of them engaged in the Twin Cities Hunger Initiative. Certainly the partners that you saw, the suits, as we saw earlier, those corporate partners who are engaged, and I think just a spirit of volunteerism and taking care of our neighbors. And so it's a real pleasure to be part of that. Thanks.
Margaret.
Thank you. It's a pleasure to be here. I want to thank David and Jason for coming out to southwest rural Minnesota to tell us about this opportunity. At our community action, there are 4 food shelves within our agency, but we do a lot of outreach also. We do a lot of SNAP outreach, and that is one thing we really want to expand on with that, along with going out into the rural communities and helping with the small food shelves that their shelves are starting to be empty. And we couldn't do all this without Second Harvest, so thank you very much. It's our big deal. And also them teaching us all about the Feeding America. So we do rescue a lot of food. We're really fortunate in Marshall, Minnesota. We rescue an average of 30,000 pounds a month. And we only want to expand on that too. So there is no food in Southwest Minnesota that is going to waste in our area, but we want to expand this into the restaurant type deal, the Harvest Hunger too. I've been contacted this last week actually. So we're excited about this, but we really try as an agency to work with people, to give them the tools, to give them the hope, to help them through that time that life happened to them so that they can get beyond that. And we teaching is a big thing for us in our agency, educating people so that they can move above that circumstances, whether it's family or individuals, to get out of that crisis and to move on in life and feel good about themselves too. So we're all about teaching with that, and just appreciate the opportunity with this.
Margaret, just for those who might be geographically challenged in Minnesota, define the cities or the major counties that your agency serves.
Okay, we have 5 counties down in southwest Minnesota. Marshall area, we have Lyon, Lincoln, Redwood County, Jackson, and Cottonwood. So we stretch quite a ways around within, a few hundred miles if you were to the roundabout. We also plan to expand out in some of the other counties too, but down in the southwest corner of Minnesota where they just got a foot of snow, I heard. I thank my husband for getting me here safely today.
Bertrand, can you tell us a little bit just about some of the global stats about the Minneapolis public schools and then your work there?
Sure. So I was introduced as Director of Culinary and Nutrition Services, which is really a fancy word for I'm the head lunch lady for the school district.
Yay!
So in Minneapolis, currently, we serve approximately 34,000 students. Of those 34,000, we have about 64,000 students that qualify for free and reduced. So it's quite a large population. When I started there about 14 months ago, our daily participation for the lunch program was about 60%. So if you look at that, we were really missing on a daily basis about 8,000 kids that qualify for free and reduced, did not get to eat, which a lot of time is their only place. Breakfast and lunch and after school snack is the only place that they get a real meal. So that gave me encouragement that at least I had somewhere to go with the lunch program. I knew we needed to do something. So we embarked in what we called Rethinking School Lunch, or Rethinking Minneapolis School Lunch, with the emphasis is really trying to reach all students, to focus really on some wholesome, fresh food. Minneapolis Public School for the past 40 years have been serving what's known as pre-pack. And if you don't know what pre-pack, it looks like a TV dinner or an airline dinner, and not the most appealing meal. It is not, it's not focused on any ethnicity. I've had conversation with Hmong Academy where the principal says, we need to look at what we serve for breakfast as an example. Those kids have no clue what a muffin is. They eat rice and vegetable for breakfast. So, listening to all that, trying to change some of the food. We're partnering with a lot of local organizations to bring more whole foods into the school system. If we look at 60% of our population live in a food desert, their idea of a meal is a bag of chips. So my idea of a meal to them, especially because they need it, is really to bring real food back into their diet. And real food is nothing more than, we call it true food. We have this whole campaign. It's True Food Rocks. And all it is just real food.
And how are the kids receiving True Food Rocks?
Well, last year, based on our numbers, district-wide lunch was about 60%. This year, we're up by 10%. So our high schools, everyone is really receiving it very well.
Terrific, great. Dr. Cutts, tell us about what's going on in the hospital setting of all places.
Of all places. Who would have ever thought? Health and hunger, right? So I'm a pediatrician at Hennepin County Medical Center, and my clinical interest for many years has been in very young children who aren't growing well. And it was really through that clinical interest that I developed a research interest in childhood hunger. One of the things I discovered is that although I could prescribe a lot of medicines very easily, that I couldn't prescribe food very easily. And in a view that food is part of health and part of medicine, our efforts to try to connect families who are struggling with healthy foods have taken place over years. And in the recent years, a piece of that has been establishing a food shelf in the hospital. So one of our challenges has been talking to people about why in a hospital. But when you think about what a hospital has to offer, this is really an infrastructure that deserves some real thought. We have a structure that has a very active kitchen that serves patients and faculty and staff and visitors 3 meals a day. We have refrigeration and storage. We have a very large department of dietitians, and we have a department of social workers who are trying to connect families to resources. And we're seeing a population for health care where the tie to nutrition is obvious and where the connection to an agency is established for other reasons. And families come to us, and I'm going to speak for just a minute about especially young children. I appreciate and am very involved in seeing that school children have access to healthy children, but we know that children from birth to age 3, 4 years are undergoing the very most rapid period of growth and brain growth in particular of their lives. And we really have to reach these very young children. Mm-hmm. Hospitals and medical settings are a very established site of care for very young children. And so this becomes a mechanism for us to reach them. So with, again, partnership through Second Harvest, we've been able to establish what we call a therapeutic food pharmacy, and to serve initially in pediatrics, but now expanded to other clinics. And with this funding, we hope to expand to some of our off-site clinics and somewhat into our emergency department, where we see a very high-risk population of families, to bring them closer to food security.
Terrific, thanks. Now I'd like to ask our panelists specifically about how they are going to use the funding that they've received from Hunger Free Minnesota in their agency and to extend their work. And what I really want to ask the audience to listen for, and we're going to go back to a couple of the phrases that have been used by earlier leaders on panels. Think about replication, think about quality, think about efficiency, because there's never enough money. Think about effectiveness. These programs were chosen by the grant panel because they met those requirements. These are considered high quality, efficient, effective programs that are really replicable and can be expanded not only in these agencies, but we hope what you're listening for is what you can take from them, however you're connected to this movement, and use them in your funding strategies, in your agency work, in your strategy thinking, because it's really that the solutions are beginning to be very clear, and this is the work that we want to happen, because these need to be real programs reaching real people, used as much as possible. So let's go back to Rob and tell us about the work that you're being funded for, and what a difference you think that will make.
Yeah, so Second Harvest Heartland is just one of several engaged partners in a pilot around an organization or a product called Efforts to Outcome that we call ETO. And this pilot was really born in the Twin Cities Hunger Initiative and is, I think, an example of all of the possibilities and challenges of deep collaboration. It's a group of hunger relief agencies coming together and trying to get on the same page around some of the tracking, data collection for our clients, and the challenges of standardizing business processes and putting those things on the same page, not only for 7 agencies, but hopefully for others in time from a replication standpoint, are really challenging for us and have been interesting. We're fortunate to work with the Twin Cities Hunger Initiative as kind of the nexus of this. The United Way has been a fantastic sponsor of kind of getting the project management going, and we're going to be working as the administrator for the project. And so let me tell you a little bit about kind of what it does in a nutshell. ETO is a cloud cloud-based database that has come out of a need that agency partners have expressed. One, for how do we find some just efficiency and cost savings in technological and data solutions that we've been looking for, as well as how do we get better data, both to make better decisions and make sure that we're reporting back to our donors numbers that are going to be useful for all of us to understand what hunger looks like in our communities. Those were kind of the driving needs for the Twin Cities Hunger Initiative to invest and look at this. What we've found as we've gone through is, in addition to those benefits, we also think that there's some other fantastic, potentially transformative benefits, which could include things like much more seamlessly tying together our network of partners into a genuine network of referrals, of reducing redundancy. Imagine if you're a client that comes into a food shelf seeking help with food, and you say, you know, I also have a broken car, which Pete alluded to before. Well, some of our agencies do car repair. How can we set you up seamlessly with a car repair referral while we're setting you up for some of these opportunities? So as we continue to work more tightly together in a referral structure and a seamless kind of database, we think that's powerful not only for our agency partners and us to make better strategic decisions, but also for our clients, many of whom are still coming to an agency or to this patchwork of support for the first time, trying to understand how they can enter it. And we've seen some powerful evidence from the Channel 1 Food Bank in Rochester, which we learned a lot from as they implemented this over the last couple years, and really have shown us how impactful this can be in making better decisions that we can tie back to some of the community close-up data and pinpointing where we can make interventions work, but also in how we can make clients be better and more efficiently served when they enter this system of ours that we're working so hard to be adaptive and supportive of those neighbors.
I had a question when I was preparing for this. I wanted to understand how this system is similar or a next generation of the Bridge to Benefits system that some of our food shelves are using now.
Yeah, great question. And so I think Bridge to Benefits, I think, is certainly is tying people directly, much more directly into programs. And I would say that the database or the ETO project is going to be more about connecting agencies together, and so to be able to engage individual clients as they come in. One of the things that was most powerful that I saw when I went down to Rochester to look at what they'd done with this program was talking with this woman who was the receptionist at Mount Olive Lutheran Church. Her name was Mary, and she described that she was one of, I think, about 15 to 20 church organizations that were part of what they called a web of care. And for her, they were not an actual provider of hunger relief, but they were, as they said, you know, we get a parishioner once a month or once every couple weeks that comes in and says, I need help. And she said, we're not actually in a great position to do that. We've given a lot of our support to local partners to be able to do that. But now with this system, I'm actually able to take their information, input what they do, and set them up with a referral visit to the local food shelf, but also make sure they get a call from Hunger Solutions Minnesota to set them up for SNAP, to SNAP application if they need that. And for us, that power of having people be able to start engaging with our nonprofit system wherever they are most comfortable doing so is, I think, one of the big advantages of how we can turn on and make ourselves more accessible and more convenient for those people who need us.
Terrific. Margaret, we heard a little bit about all the counties that you're serving. I know one of the parts of your application in the grant process was how you were going to really use the data that we saw to really help you shape priorities around what strategies you're going to implement in your broad couple 100-mile area. Talk about that link from data to strategy to work.
Okay. Yes, we're going to access all with the data and that, and really pinpoint the areas that have more than missing meal gaps and such, in which we pretty much have found that out already with that, and just expand out a little bit more than what we have with our agency areas. Different ways is just going out to the area food shelves. Some of them outside just my smaller agency area literally have empty shelves. And when the clients came, they were 30 miles away, and they came and they said that our shelves are empty there, we need to use your food shelf. I just needed to do a little research too. I did serve them, of course, that day, but they do have empty shelves. So going out and seeking out those areas, we have some smaller, very rural areas and counties that really need help. They're kind of, you know, they're out there by themselves. getting into the senior citizens, meeting with them at their senior sites when they're playing cards and bingo, going one-to-one, as you mentioned earlier, just going out to them and talking with them, pinpointing those areas again on the SNAP. We do the SNAP outreach, as I mentioned, but how many are actually utilizing it? And we're finding that a lot of our seniors aren't. They never thought, they don't want, they still have the welfare, which isn't even a word hardly in the vocabulary anymore with us, but really just talking to them. So those are the areas with our data that we really want to pinpoint out. With that, I had a senior last week that I was helping at one of the neighboring food shelves, and when I got to the cereal, he just looked at me and he said, I haven't had breakfast for a while. He's never accessed a food shelf before. He's never used SNAP before. Needless to say, he's filled out the application the next day with that, and he's called me or stopped in 3 times since last Friday into our office just to thank us for opening that up. He said, I have to swallow it. He said, I have to go out and just deal with it. It's life, and life happens to all families, with that. So reaching one-to-one with that as we go out into the counties is going to be something we're really going to emphasis on. The areas, we know the counties that have more percentages of the missing meal gap, we'll hit with those first. Marketing's my field before this field, so giving up isn't done easily, and success means a lot to me. So that is something we'll really strive for. Rescue food is something we're really going to reach out to in the rural communities. We do it in our area now, but the smaller grocery stores, reaching out to them, and then the restaurant type of it too. Working with the NAPs, again, getting in those areas with the, showing us the data that's so shortage of the NAPs with that. And a lot of them haven't heard of SNAP, but they heard of food stamps. So I coordinate that with, asking them about the Farm Bill. And then they perk up because they've heard about the Farm Bill. And then I let them know that, there are federal dollars out there that could be coming to Southwest Minnesota, but someone else is getting them, and we're not getting all that we have coming to us. They're interested in that. And then I said, if it helps our local grocery stores, because our markets in Southwest Minnesota, I will brag about them. They are so wonderful. And I said, it's going to help our local markets. I said, you're going to bring those dollars from the government into Marshall and the area small communities, so you're really helping our local markets. Well, then, if I can help somebody, okay, let's do that application. So you need to go on that line of think. They need to help someone, anyone over 65. If they can't help someone, they're not going to feel good about themselves. So using that approach has been so easily. We have in our rural area a lot of kids that have lost their jobs in the city area, wherever. They've moved back to rural Minnesota. They've moved back to where mom and dad live. They're safe, secure. They have a roof over their house with their children. But now mom and dad can't afford to have all those family members move in with them. And so the mom and dads are coming to us in tears, saying that, how do I tell my children that I really can't afford to feed them? I don't know what to do. And sometimes as a community action, they think we'll solve everything, and we have a huge agency that is wonderful. But giving them the tools, planting an extra roll. We go around to the churches is another one of my goals, to plant an extra roll. And the health, I'm so glad that you mentioned that. I've had doctors now starting to do this, and we're working with the public health, the nurses, and the doctors in the schools, let alone the hospitals, but giving those the SNAP information, giving them the information to tell them. And so now we're having clients come in the food shelf saying, my doctor recommended SNAP. And I'm like, yeah, who's your doctor?
Yeah,
just to find out. I'm so proud. So we just need to work with our agencies more, and that's our goal this next year. Get out there, work with the agencies, collaborate together, and get Minnesota people fed so they're not going to bed hungry.
Margaret, I have a question, and those are beautiful stories. Thank you. Thank you for the work you're doing. So the community close-up data, as in your office, as you or you probably got a staff member kind of starting to work on this data, how have you found the tool to use to sort of segment and set priorities? Have you started using the data tool, and can you share if it's been fun, easy, hard, tricky?
We're just starting on it a little bit with that. Tricky could be, one word with that too. We know what our stats and how much we serve and everything, with that. But getting out into the area, my supervisor actually does more of the data part with that. But tricky, but within a slow process here, learning a lot with that and stuff, that there's more areas. Some of the smaller counties, we have, you know, I don't want to, well, the poorer counties, however, stats-wise and stuff, the wages, they just don't make a lot per hour down there in some of their jobs and stuff. So just looking on that and trying to work with that. But we do have some of the counties that are even alongside the 5 counties that we serve that will be. But my supervisor's actually working more with the data process with
Yeah, and I'm sure the hunger-free staff would be happy to sort of reach out and help you really break down some of that data, because it looked great. It also looked like, for me, as a love data, not so technology savvy, being as old as I am. But anyway, it looked like it could be a little overwhelming too.
It is.
A lot of
that.
data.
She does the data, I do the talking. Usually how it works.
That's right, that's right.
She sends me out of the office.
Yeah, I think it's important to find that staff person and connect with the folks that can help you break it down. So Bertrand, I have to ask you this personal question. I love tater tots. The only place I ever got to eat them was at school. Are you eliminating tater tots completely from the
As a matter
school
of fact,
menu?
we're putting a tater tot hot dish on the menu next year.
I'm such a Minnesotan. All right. Tell us, in your grant, you wrote about, you're really taking this on as a mission, and it's within the school and your true food work. It's also being an advocate in the communities and with the families that are coming to school. Tell us more about your approach and how you're hoping to really engage the students and the families.
Well, one of the areas that we've identified that we know has a tremendous impact on children is breakfast. And participation in lunch was low, breakfast was even lower. Breakfast is still lower. So we also know that currently in the education world, everything is about test score. So every minute of the day has to be dedicated to the curriculum. The lunch periods have shrunk, the classes have increased, and breakfast, unfortunately, takes second to, you know, the buses arrive. They only have 5 minutes. They rush through the cafeteria. They grab something to eat. The bell rings. They don't have time to eat it. They leave it on the table. So we knew that there had to be a better way. St. Paul has done an absolutely fabulous job. You mentioned the kids walking through. So we did spend some time with Jean. We knew that a breakfast in the classroom program would alleviate some of those issues. We do have breakfast is available to everybody, so there's no stigma associated with taking the food. It is universal for all children of the district. But we needed to find a way to convince the teachers that, first of all, there is a direct correlation between nutrition and learning behavior. You cannot have a child come to school hungry and expect them to concentrate on learning. For some reason, educators still don't get that. But that's another mission I have. So we found a few schools, a few what we call champion principal that understood that we needed to do something, that were willing to try to pilot the fact that now, oh my God, there was going to be food in the classroom, and so there's rodents and there's bugs, and no, there's not, but that's the perception that there is. And what we find is that kids are eating their entire breakfast because now they're not rushed to eat it. So that's a huge impact. Yep. Participation is up because now they know they don't have to rush it. There's no stigma. They don't have to waste the food. They can actually take the food and go in the classroom. What we found is that there is no, it's not taking away from teachers' teaching time. It's actually becoming part of a routine, part of breakfast. We have some schools that actually the principal is going to mandate next year that all their teachers eat with the kids to kind of build a community around the food for breakfast. So we knew that's the way we wanted to go, but our biggest problem is how to communicate to the community, how to engage the kid, how to let the parents know that we have breakfast in the classroom. How do we convince the principal and, you know, the administration that this is a good thing? So through this grant is really the grant, we're going to use this money to promote, engage, and educate the community, the kids, the parents, and the administrators of the benefits of breakfast in the classroom. So we've identified 13 schools that currently do not have breakfast in the classroom. Their breakfast participation is below 40%. They all are above 60% in free and reduced. So they fit what we really need to target. So our goal is to increase participation from 40 to 60% for breakfast. That will roughly translate into 750,000 meals in a school year. But to do that, again, so our effort is really going to be about the marketing. I have the tools, we have the infrastructure to do the breakfast. I just needed the help to communicate the message.
What does the school board and Superintendent Johnson, what are they saying about this? Are they aware of these efforts?
Yes. They're all very supportive, but first and foremost, their priority is not the school lunch program. So anything I can do to make them look good, they love it, as long as I don't cost them any money. I think we have brought more and more awareness to the administration about the need of real food and good nutrition. We are making a point for them to understand the correlation between the two. You know, attention deficit disorder, cardiovascular diseases, obesity. Obese kids are starving because they're lacking the nutrients.
Right.
So we're making the effort to communicate that. And I think it is starting to pay off. We're seeing principals that are now embracing.
But the gatekeepers are the real principals, is what you're finding?
Yeah. So, but we have a lot of champions that are
13 principals, I don't know, I think we can make a difference. Have people in this room. That's great targeting and
our,
great
our
focus.
best advocates are the principals too. The ones that have tried it, they're selling the program because they really see the difference.
Yeah.
So.
Dr. Cutts, I think all of us in this room care so deeply about children from all of our lenses as parents and grandparents and what we see in the community and the risk children can sometimes be in and what a difference a helping hand can make. I'm fascinated by your focus on birth to 3 and very understanding of the brain development issues that happen in a child in those early years. Maybe you could just talk a little bit about that and talk about why that nutrition is so important and what are you seeing as effective and what are some of the barriers working obviously with the mothers and the parents of those very young children.
Well, you know, I think the challenges in working with really young infants, toddlers, and preschoolers is that unlike adults who have established feeding habits and their diet is relatively, the recommended diet is relatively set at that point in life, the children are under development and the diet changes. And what we start out advocating and promoting breastfeeding for all children and move into the transition of introduction of other foods and how that then transitions into acquiring healthy eating habits and what that means for an individual child in a lifelong trajectory and to move into table foods and what it is that they start to drink and continue to drink, for example. This is just a very critical time in a child's life and in a family's life. You know, one comment I would want to make is that although my lens in may be through a young child, that we know from data that any child who's experiencing child food insecurity has adults in the household who are truly sacrificing their own health in order to try to protect young children. So we may identify children as being hungry, but we're really identifying a family unit. And I think that's one of the reasons why our efforts with the food shelf is really to go to the family unit and to serve all members of a household because everybody's going to benefit from that.